I was just reaching out to see that I recently had bacterial prostatitis 3 months ago. So the doctor told me after I had an infection of chlamydia for 1 year without my concern, without me knowing. And a lot of the symptoms, they already went away, like the golf ball in the bottom, the burning, the penis, the testicles, hurting, all of that, the pain, all of that, that already went away. It all went away. Most of the majority of it, I'm like at 85, 90% already gone. It's just a little tingling here and there. But my main concern was my performance. The ED, the erectile dysfunction, is like very low. It's hard to get an erection, and if I do get an erection, it's very weak. And I just wanted to see if you had any type of tips that can help me, or what more can I do. I haven't seen a neurologist yet. It's taken a lot of time to get me there, but I'll be there in July, and I'll ask further questions. But I'm doing my own help so I can try to recover faster to get my sex life, my performance back to its normal ability. I'm a young man, so I do appreciate you, doctor. You have a great day.
Oh, thank you. Thank you so much, Omar, for this question. This is great because one thing that Omar mentioned, and I don't know if you mentioned it when he said it, is that he had chlamydia that he didn't even know that he had. And that's the thing about guys with sexually transmitted infections. Until your partner comes to you and says that, hey, you gave me something, I got something, guys usually don't know that they have it because you don't have a yearly exam that you go through and you get all these tests or whatever. And so for him, what was happening is he was carrying around chlamydia for a while and didn't realize he had it. His doctor treated it, but he has a residual situation where now he's having erectile issues. And so he was diagnosed with prostatitis. The cause of the prostatitis that they gave him was the sexually transmitted infection. And now, after being treated for it, and he said a lot of the burning and all the pain symptoms have gone, but now we have a residual issue with erectile dysfunction. So prostatitis, regardless of what's causing it, is actually the most common urologic disease in men younger than 50. And it's actually the third most frequent urological diagnosis in men older than 50. And so for some people, it stays acute, meaning it's just a flare up right now. What can we do to get past it? And for other people, it can actually end up becoming chronic, meaning that it's lasting for a long period of time and continues to cause some pain and some issues long term. So prostatitis symptoms can really vary from person to person. I remember when I was in training at Meharry, we actually had a patient whose prostatitis was so bad they had a high fever and they were actually in the hospital. It was so severe that they were in the hospital, and we were looking for an infection and found that it was prostatitis that was causing it. It can be as simple as flu-like symptoms, just not feeling that good, just feeling flu-like, pain when you urinate, blood in your urine, stinging sensation when you urinate, maybe even the urethra or the tube that the pee is coming out of at the head of it can actually be burning and you're not actually peeing. Difficulty urinating, getting it to start, or maybe even rushing to the bathroom. Oh, I gotta go. Urinating more often than normal, a little bit of discharge from the urethra, pain either in the urethra or the penis or the groin, radiating to the testicle. Pain in any region could potentially be prostatitis, any of the regions down there. Having blood in your ejaculate, that could actually be prostatitis. Or having any type of ejaculatory disorders like premature ejaculation, like post-orgasmic pain. After you orgasm or ejaculate, you just got referred pain to a certain area, or pain in your testicles or your balls. Any of those could be some form of prostatitis. And prostatitis, it causes issues because now there's a lot of emotional distress. You don't feel like having sex, you're avoiding it, you're having pain. It can be a whole thing. And then, of course, one of the associated symptoms is erectile dysfunction. As a matter of fact, there was an article that was published in a journal by a group of Chinese scientists that really found that almost 80 to 90% of guys who've had some form of prostatitis in some way, shape, or form ended up having some erectile dysfunction in some way. So I don't want you to think that prostatitis is always because of a sexually transmitted infection. Itis, whether it's colitis, prostatitis, anytime you hear itis at the end of the word, it really just means inflammation. So whenever there's a diagnosis of prostatitis or any of those symptoms going on, we want to see, is this caused by an infection? Is it caused by an injury? Is it caused by a virus? What is potentially the cause of the prostatitis? In his case, in Omar's case, the actual cause of it was chlamydia. But there can be a variety of other causes. The cause of getting a prostate infection can be bacterial. It can be a sexually transmitted bacteria. It could be a virus. It could be gonorrhea. It could be trichomonas. It could be any of the ones that you hear very often. And so if your partner happens to have a sexually transmitted infection and you're not really seeing any symptoms, this is why it's always good to still go get checked and or treated, because potentially that bacteria can stick around and cause problems and you don't even know it's causing the problems. Because sometimes a prostate infection or even a sexually transmitted infection can go unnoticed. You don't even know that you had it. In his case, he feels like he may have had it for a year or so without even really realizing that he had it. Some of the risk factors associated with it are if you had a surgical procedure, you've had a catheter placed, you've had unprotected sex, unprotected anal sex, or even actually having foreskin issues where maybe your foreskin is stuck, like phimosis, where it's stuck and it's trapping bacteria there that can actually get into the urethra and climb all the way up and actually infect the prostate. The thing about prostatitis is this: if the bacteria or the germ or the insult that's causing prostatitis is not eradicated and blocked out, knocked out, or eliminated, this inflammatory process can actually stick around and become chronic. So in Omar's case, one thing that I realized that when we treat sexually transmitted infections, oftentimes we'll treat it and not really make sure it's gone. So one thing that you want to do is make sure that the infection is actually gone. And I would even venture to say, Omar, that you don't want to just have them check your urine. You want to actually have them check some of your prostatic fluid. So what they'll actually do in the office is a little bit of prostatic milking, where they massage your prostate from internally and actually try to milk some of that fluid out so that they can get some of the fluid, send it off for analysis, and see, has all of the infection cleared up? So that's one thing. Now, before they were treating with antibiotics with prostatitis, they were doing prostate massage to treat prostatitis. And then as time went by, they actually were doing prostate massage along with antibiotics to treat prostatitis. Now, prostatic massage is seen more as like an off-cuff, like who would do that type of thing? And they really just throw a bunch of antibiotics at it. If they go back and there's still some, they'll just throw more antibiotics, and just keep rotating the antibiotics till they feel like, hey, that's the best we can do. Nowadays, what they'll do is treat with some antibiotics, and anti-inflammatory like Aleve or ibuprofen for the pain, and Cialis or Viagra for the erectile issues, and then they'll send you out the door on that. The problem with this whole process, and let me just show you this really good slide that kind of sums up what's happening when you get inflammation. So I want you to think about it like this. So I always say our body, God created this amazing body for you to fight off things and to do its best job at protecting yourself. So when our cells are doing that and they are fighting off invaders and they're fighting off all of these things that are coming at us, just like running to the store with some gasoline, right? Your car has byproduct. The engine burns, but we got byproduct. We got fumes. We got toxic fumes, right? So as our bodies start to actually fight off, and we fight off and we've got this inflammation response. Inflammation is good if it just comes and does its job and it's cleared and it stops. But the problem is when our body is mounting an inflammatory response to try to cure itself, now it's got byproduct of that, right? So as your mitochondria is being energetic and fighting off things, it's releasing toxic substances in that process. And those toxic substances need to get cleared from the body too, right? So any fight has its own residual problems. So the problem with fighting off things like bacteria and toxic invaders into our body are the byproducts. That's why we need things like antioxidants on board to try to help clear out all that stuff so that our body, our white blood cells or whatever have you, is fighting. Now that gas that they're releasing, the toxic products that they're releasing, can actually be cleared and dealt with too. So I don't want you to walk away from our discussions thinking that all inflammation is bad. We need inflammation to cure ourselves. But what we don't need is for that inflammation to just keep going and keep going. And what we also don't need is for the inflammation to be fighting off things, but the rest of our body to not have enough antioxidants to fight the free radicals and everything else that's released from the fight, if that makes any sense. I'm hoping it does. So I want to show you this complicated product, this complicated diagram, but what it really shows us is how this process of inflammation goes and gets out of control. Okay, so what you're looking at here is from this great article, and I'll post the resources below. But what they're showing is, look at that smiley face there. That smiley face is representing the end of the acute inflammation that can happen after prostatitis comes and is battled. The battle is won and it's gone. But what you notice here, pay attention to the fact that not only do we have to kill the bacteria, but we also have to activate all of the cellular process that goes into that, right? And then at that point, you can potentially end acute inflammation. But if that bacteria never gets killed, and then if you don't have the necessary like antioxidants on board to really help fuel, this process can get stuck. And instead of killing the bacteria and ending inflammation, it can end in this vicious cycle where the inflammation becomes fueled and it actually becomes chronic. So what we know is that in order to eradicate this process and get prostatitis back to normal, one, we got to eliminate the germ, but we've got to also get rid of the persistent inflammation that may be there. So in Omar's case, what's happening is, sure, the germ seems to be gone, which in my thought process, it probably isn't. It's very rare that one round of antibiotics to treat prostatitis has gotten it gone. But then what's happened too is, remember, when we're mounting that immune process to fight off all those invaders in our body, that's what pus is, right? That's why sometimes with prostatitis, there's pus in the prostate. Because why? Because the macrophages and our body's defense mechanism is going in and digesting products, digesting bacteria, chewing up the bacteria, chewing up part of the prostate even. So that's why pus pockets can form. And what do we know about pus? Once pus is there, or once that process is there, the only real way to get rid of that is to drain it. If you have an abscess on your face or an abscess on your finger, you can take antibiotics, but unfortunately, that infection still is there, right? You're still pushing on. I think there's still some left, right? Ever have that big pus thing on your face? You keep pushing it, keeps coming, and every day you're like, I think there's still some more, and you keep pushing on it and mashing on it. That's probably where Omar is with the infection, is that even though the infection is what we consider under control, there's still some there. And so what will probably happen is the doctor will keep throwing antibiotics at it, but what I feel like is missing from the process of treating prostatitis these days is really just a nice, gentle massage when it's not in the acute phase. Now, when you're hurting and when you're in pain and all of that's not the time for the doctor to prescribe or suggest prostate massage or for you to even try it. It's actually when the symptoms are controlled, because remember, that same pus that forms when your body is fighting off anything, now we've got a boggy prostate with a little bit of infectious fluid there that needs to come out. How else is it going to come out, right? So one way to get it out is ejaculating, right? So ejaculate, some of it comes out. But the other way is what we call prostate milking. That is actually going to be where you are stimulating your prostate while ejaculating. And what that's doing is, when that prostate decides to snap back and shoot out the ejaculate, it's actually going to shoot out more of the stuff that needs to come out. And what you'll find is, in guys who've had chronic prostatitis and their doctors sign off on this process of prostate milking, some of that ejaculate actually has a little bit of an odor to it because it's getting some of that infectious stuff out that needs to come out. Because if you think about it, how else is it going to come out? Like, where is it going to go if there's not some way to milk some of that out? So that's another thing that I would suggest that Omar talk to his doctor about is ask. So he's going to see the urologist, going to put him on some stronger antibiotics, maybe put him on some Viagra, so on and so forth. Anytime you're taking a round of antibiotics, you've got to take your probiotics. We got to put that good bacteria back there. So that's one thing. He's got to get on a good probiotic. A spore biotic is a pretty decent rounded probiotic that you can use to put the good bacteria back there. So that's one thing. Then you're going to need a lot of prebiotics. Prebiotics is fiber and roughage. So increasing the amount of green leafy vegetables, celery, things like that's got good fiber in it to help feed the good bacteria that's there that gets wiped out when you take the antibiotics. That's one thing. 3, you want to think about boosting your nitric oxide levels. Anytime you are finding yourself having erectile issues, you want to check your nitric oxide levels and try to boost them either with smoothies or with an approved nitric oxide boosting supplement. And then the other piece is focusing on prostate health now. This would be the time to integrate the pumpkin seeds in. Think about some saw palmetto. Think about a supplement that is designed specifically to decrease inflammation in the prostate. And now is the time to add antioxidant and anti-inflammatory products to your regimen. So this might be the time you would decide if curcumin or turmeric might be something that you'd be interested in. Quercetin might be something that you're interested in. So now is the time to fight inflammation with anti-inflammatory, natural versions of anti-inflammatories so that you can actually start to heal. And now is also the time, Omar, to speak to your doctor about whether or not they'd be okay with you doing prostate massage and trying to milk some of that substance out, because there's plenty of great data and articles, and we'll drop some of the references in there that reference combining those high doses of antibiotics that they're going to give you with a good prostate massage. But I also caution you, anytime you're taking any antibiotics, you've got to put those good bacteria back in your body by using a quality probiotic. Okay? So this is great.